All right, well, it is that time. Dashboard Dissections, Cosmetic Surgery Edition. So, today I am driving home from Clarksville. Um, and I love that little office. It's so small. Our staff is great. It's just such a nice place to see consults and follow ups and be able to take care of patients up north. Um, But today we're working on scheduling around the holidays, and boy oh boy is December getting full to the brim. I'm trying to add more and more surgery days so that I can make sure that I can get everyone in before the holidays, because I know that's a huge time that everyone likes to have um, utilized for surgery, since you can hide the garments and you already have time off of work and you have extra help around the house. So I've been trying to open as many days as possible. So if you want your surgery in December before the holidays, you better hurry up, because there are few and far between spots. And I would love to get you taken care of before the new year, because 2026 is looking like it's going to be a wild and crazy ride. Holidays. It's a really hard time for some people. But hopefully we can make that better by getting your self-confidence back and getting the body you've always wanted and being able to live the way you want to live. I guess um, this weekend, my husband decided that we needed to do our outdoor Christmas decorations. So that was really fun. Does anyone else use those plastic gutter clips for the lights? We've started calling them Satan's clips, because they are horrible, and my fingers were numb trying to put them together and get them on the light and get them on the gutter. Oh my goodness. And then my husband wanted the super bright lights, and we only had the bright lights from last year, so we had to get super bright. That man is Cindy Lou Who, and I am the Grinch. I just want to sit on my couch with my dog. My dogs and my cats. Because honestly, that's what the holidays are about to me. Football, on the couch, with my pets, and food, obviously. Anybody else just there for the food and the football? That's where I'm at. Um, my favorite things for Thanksgiving are the sides. Oof, all the potatoes in all the ways. I will die on this hill. Potatoes are the most versatile, best food, singular food item around. Like French fries, potato pancakes, hash browns. The list goes, vodka. The list goes on. Okay, potatoes are underrated, undervalued, not by me, but by others. And that is not just because I'm Irish. Okay? I will die on this hill alone if I have to. But potatoes are the singular best food, I will say, ever. And that's that. Speaking of football, being an Iowa fan was really, really tough this weekend. That loss to USC just about ruined my Saturday, so that sucked. Um, yeah, I can't even talk about it. We looked so good in the first half. I mean, 14 points in the first quarter was amazing, and then we just couldn't do anything at all after that. Horrible. But at least we're not South Carolina. But still, pretty crappy. Anyway, holidays. Um, Winter is a very common time for people to get cosmetic surgery, so if that's a time frame that you're interested, especially if you're trying to utilize your already off days for different holidays, definitely get scheduled earlier rather than later, especially if you have a very specific time frame in mind, because most women want that. Fall, winter is a very, very busy time, so I usually recommend getting those days on the books earlier. It's not a sales pitch, it really truly happens. And then people end up getting stuck waiting until the end of the year, because I travel for Christmas also. And I would hate, I don't know how people do this, but it really hurts my soul when people operate on someone and then leave town. I understand, I have done it, but I really, really, really try to avoid it. And the main reason is I know the minute that I schedule something like that, there's going to be an emergency and I'm not going to be in town. And that honestly would haunt me for a while. And, you know, we all try to have coverage when something like that happens, but it never feels good to not be there for your patients in a really vulnerable time. And I know other surgeons can speak to this as well. It feels awful to not be there when something bad happens, especially, and I'm sure other specialties feel this, but as a surgeon, I think complications are so much more personal because it was literally my hands that did it. And now that I do purely elective surgery, it wasn't something that was necessary. And I hate to say this, but a bleed that happens after an emergent surgery, I feel like I can sleep better at night because I know I had to do what I had to do and there was no other option. If I didn't do something, the patient would die. That's not the case here. My hands did something that harmed them that was unnecessary. And I think one thing that I learned in my training that really helped me kind of deal with it, because in the beginning, when you get your first, I will never forget my first terrible complication, and it was on a more elective gallbladder surgery. But those complications, they stay with you. They stay with you, and if they don't, then you're burnt out. There's something going on, and you need to look inward, because that should bother you. Those complications should bother you, and if they don't, that's a surefire sign that something is not going right for you. And I would hope that you would feel comfortable reaching out. Even if it's to me, if it's to someone else, just reach out, because it gets exhausting and it's heavy. It's really heavy to carry all of that. But being there for your patients in a complication is really hard, personally, to accept that and to go through that with them, but it's important. But going around and getting there. The thing that I learned that really helped me deal with those complications was lean in. Lean into your complication. Don't shy away from it. See that patient, talk them through it. Not only will you feel better as the doctor because you took care of it and you were there every step of the way, but the patient will feel better because you're there and you're the one that knows what it should look like. I think another thing that I used to do is I tried to make things sound better. I tried to make it sound like it would be okay, and it usually will be, right? But you also have to set a realistic goal and tell them a realistic time frame. Granted, I'm not perfect, but I can give you an estimate, and I can tell you what I've seen in the past, and we can go through it together. Boy, sometimes my mind goes to dark places, huh? That was deep. But I guess the reason that it all kind of got brought up is I saw a patient today as a follow-up. It was a 3-month follow-up for a breast lift with implants, which is an extremely risky surgery. A lot of women don't realize that. It's one of the riskiest things I do, that and a Brazilian butt lift. Those are the 2 riskiest surgeries that I perform. But I had a breast lift with implants that had some of her wound fall apart, and it's one that I can't figure out why. The only thing I can think of, there are 2 things that I can think of that could have been the cause. Number 1, always has to be a technical error on my part. However, it started a lot later than usual. It was usually at usually a complication like this that's my fault happens within the first 2 weeks. If it's something else, it's usually at the 3-4 week mark. Her complication started kind of at the 4-week mark after surgery, and the only thing I can think of is that she was a prior smoker. Granted, she quit before surgery, and my bare minimum recommendation is 2 weeks before surgery and 8 weeks after surgery to optimize healing. Optimal is 6 weeks before surgery to really clear out the lungs and have them functioning as best as they can and to decrease your anesthetic risk, and forever afterwards to never pick it back up. But I know my addiction to cherry Coke, my addiction to cold foam, as we all know, is heavy, and I know that that's really hard. But she was a prior smoker, and I think some of that might have affected her wound healing. It's healed up beautifully, however. That is the other thing to know, is that no matter how large your incision, your wound is, it will heal. Your body will do its job, and so will I, and we'll get through it. So, that's what I think happened, is that maybe she had some residual damage from her nicotine use, and that was part of the issue. Ultimately, it could always be a technical error on my part that had something to do with it. She didn't have any spitting sutures. There was no infection. So I really don't know. I don't know. And that's going to bother me for a while. Speaking of bothering me, why is it so dark? I hate it. Daylight savings sucks. We didn't save anything. Especially not my sanity. I can't handle this. It's dark when I wake up and leave. It's dark when I get home. And I still have to put sunscreen on. And I don't like it. Nothing worse than putting sunscreen on in the dark. Speaking of sunscreen, always put it on. It's super important. Even when it's cloudy. Even when it's only light for like 4 hours in the day. Even when you're inside all day. Even though it's beautiful outside. That's okay. It's alright. We keep it on. We keep it in our routine. And you know what? We're going to age like fine freaking wine. That's the goal. You know what I need to order is probably a light, because this is a little dark. But dark topic, dark lighting, it all goes together, a little mood lighting. You're going to watch as this video podcast really, just takes off. I'm just going to get better and better at this, y'all. Okay, so stay tuned, because like I said, 2026, big things. Big things. I told you I'm keeping it close to the vest right now. Big, big things. Stay tuned.